I'm pretty sure something is behind my chest wall that's causing all this pain. And there wasn't. It was just this whole inflammatory response that people get when they get these infections. Doctor to doctor to doctor, over the course of 5 months, severe weakness, couldn't lift a fork, my arms stopped working, couldn't walk my dog, light and sound sensitivity, severe anxiety, depression, and insomnia, suicidal ideation, every single thing you could imagine. I had 38 of 60 symptoms that were on a Lyme checklist. And I ended up in heart failure. And I saw 12 doctors within these couple of months that everything was going haywire. And not a single one of them took my tick bite seriously and would consider any further testing, would consider that the initial infection had never cleared, would consider that ticks, who we know transmit tons of diseases, could have transmitted something else to me in that bite, something that would have needed an additional kind of treatment than doxycycline. Nobody, not a single one. And they did not express curiosity, and they just shut me down. And it was kind of like, it's in your head. The thing with me was, when I went into heart failure, there's really no arguing that. And then it's, well, but we don't know why. Could it be from the tick bite? No. Why? Because I went to medical school. This is the kind of stuff that I would hear.
Yeah, I think what we're finding out, and especially in this day and age, especially as we are doing more in the world with integrative medicine, integrative approaches with the Western and the Eastern, and I prefer to work with doctors like that, even in my own practice, is that
for sure
you got to be your own healthcare advocate.
Yeah.
Right?
Yes.
It's not just taking the word of what the doctor says. And I'm not saying that medical doctors don't know what they're talking about, but the ones who are more progressive and are open to the possibilities that maybe they don't have the answer are the ones I actually would want to trust more.
Oh, absolutely agree.
Yeah.
And I would say that they don't know what they're talking about when it comes to complex chronic illness in the mainstream. And I agree with you 100%. If you know you have a tick bite, you need, then you have symptoms, you need a specialist. Like, there's no question. And yes, if you have all these weird, like, new onset of psychiatric physical symptoms, or even just not all of them, but some of them, and they're not explained by things that make sense, integrative functional medicine, Lyme specialists trained by ILADS, ILADS.org. Those are the doctors that you want to see. Just save yourself the trouble of going down all the different specialties and mainstream medicine, because they're just simply not trained to evaluate patients for infections, very commonly that are causing autoimmune, psychiatric, and neurologic diseases. And I would also add toxic mold to the big black hole in medicine that mainstream doctors don't know anything about. They're not taught about any of this stuff. And it's crazy to me.
And that's an area that you and I were just talking about before, about the just how severe mold can actually be, and the kind of complications it can really cause with our immune systems.
Mold is used in biowarfare. Mold is used, mycotoxins are used for a drug called Cellcept, which people take to, it's an organ rejection drug, like it's an anti-rejection drug. So it's so immune suppressive that they use a certain mycotoxin to make that drug. It can cause dementia. It can cause death. People get infections in their lungs. I know, Brittany Murphy allegedly died from, and so did her husband, from mold toxicity. But it causes severe neuropsych illness, severe physical illness, autoimmune diseases, the same stuff. The body can only express itself in so many ways. And these are the big things that nobody is talking about in the mainstream, that are the most important things to be looking at when you don't have other answers that make sense. Like, stop drugging your patient's symptoms and find out what the root cause is, and then treat that. And let's see how people do.